He currently works on the Horizon 2020 and IMI-funded RADAR-CNS project. His work focuses on understanding the value and potential of portable and wearable technologies for monitoring symptoms of multiple sclerosis, epilepsy, and depression in healthcare practice in the UK and across other European countries. Jake completed his PhD in 2018, which explored the use of machine learning in predicting depression in older adults, capturing user and clinician views of using technology for these purposes. His interests are in the use of technology to support mental health through predictive and preventative approaches. I'm going to give a little bit of housekeeping information. So firstly, please could you make sure to stay muted unless you are talking. The webinar is going to be recorded, but the recording is not going to be released until the paper is published. We also ask that no slides or graphs be shared. Jake is going to talk for around 30 minutes, and this is going to be followed by questions and answers. It's preferable that questions are taken at the end rather than throughout. So we'll have a 30-minute presentation and then around 15 minutes for a Q&A session. If you have questions, please raise your hand or pop them in the chat, and I will be talking them through when Jake has finished his presentation. So moving on to the main reason why you're all here. Welcome, Jake. Thank you so much. I'll pass over to you now.
Thank you very much, Faith. It's a pleasure to be here. Let me get my slides up. This one here. I'm going to go from the beginning. There we go. Can I just check, Faith, can you see the slides, please?
Yep, that looks great.
Lovely. Thank you very much. Well, welcome everybody. Thanks for coming along. This presentation is about the impact from smartphone apps and wearable devices on clinical practice. So in RADAR-CNS, we have done a large-scale survey of healthcare professionals to understand their views and experiences of using smartphone apps in clinical practice and their patients' use of smartphone apps and wearable devices. As an overview of this presentation, it will be around 30 minutes. There's 4 sections. Section 1 will introduce and provide methods and demographics from the study. Section 2 will look at which healthcare professionals use digital smartphone apps and what kind of apps they use. Section 3 will look at whether healthcare professionals report that their patients use remote measurement technology, and if so, for what purposes. Here, just to provide a definition, remote measurement technology, we are including smartphone apps and wearable devices that collect data within that definition. And section 4 will look at the impact of remote measurement technology data on clinical work. So in the first section then, I'm going to tell you a bit about the why, the how and the who. So why we did this study, how we did it, and who responded to it. So a bit of background on the why. So smartphone apps and wearable sensing devices are increasingly used in healthcare. So there are examples in the literature on diabetes, hypertension, arthritis, mental health, among many others. And remote measurement technology, as I have defined it, is being explored in the RADAR-CNS project. RADAR-CNS stands for Remote Assessment of Disease and Relapse, and CNS stands for Central Nervous System. So in this very large European project, we are looking at the use of remote measurement technology in the care of people with epilepsy, multiple sclerosis and depression. And we have very large-scale observational studies going on and finishing in those 3 conditions, with the use of wearables and smartphone apps for monitoring them is being explored in these. So it's very important to understand current use, so whether these devices and apps are being used in clinical practice already. And this is important for the RADAR-CNS project because we want to know whether the technology that we're developing has a place in clinical pathways. And it's also useful and interesting outside of the RADAR project as well to know whether clinicians are using these types of technologies already. and to know whether they view these technologies as impactful, whether they think that data from patients' wearables is useful and impactful on their work. So at the University of Nottingham, as part of RADAR-CNS, we've already done a smaller scale survey with 28 clinicians and patients within the RADAR consortium to understand views there, and also some more in-depth interviews with 26 healthcare professionals. And this survey was a much larger external survey of healthcare professionals working with patients with MS, epilepsy or depression. It was conducted between February 2019 and March 2020. So this is before lockdowns in most European countries, just to provide some context there. The methods, we decided that survey methods were a good way to do this, to gain information on the views and experiences of clinicians. This is partly because they take not very long to complete, and because they can be done at a time of clinicians' choosing. So it's a good way to collect a large amount of data. To collect the data, we used the JISC online surveys platform with a range of different question types. And the recruitment was done via networks associated with the RADAR consortium. And we also reached out via the UK NIHR, that's National Institute for Healthcare Research, Clinical Research Network. Now, this is a network of all of the healthcare trusts in the United Kingdom. And through that network, we were given access directly to those healthcare trusts who were able to cascade down the survey to clinicians working for them. So that was a really successful and useful way to recruit. We also recruited via LinkedIn groups and Twitter. So in total, we had 1,009 responses to this survey. 3 of these responses we excluded at data cleaning because they were either improperly completed in terms of the consent questions, or the survey itself was insincerely completed. So our final survey, our final sample for analysis was 1,006 responses from healthcare professionals. The demographics then, so who responded to this survey? Well, we've got here some data on age group in the top left there. So you can see that we had a good broad range of responses across different age group categories, with the most from the age 41 to 50 category. In terms of clinical setting on the right, the large graph on the right here, again, we had good representation from different clinical settings. So of the named clinical settings, which are all of these apart from other, you can see that among these, at the very least, we had still more than 50 responses. That's from specialist care. So we've got good responses from different clinical settings. The most came from mental health outpatients, followed by general practice. In terms of country, now, unfortunately, we didn't have such great success recruiting from European countries other than the United Kingdom. Again, this is partly because we had such great success recruiting through the Clinical Research Network in the United Kingdom. And while this is unfortunate, this is the state of the data. So it's good just to be aware of that as we look at the results from this survey. So in terms of job role, we can see that we had the most responses from nursing job roles. Now, nurses cover many different clinical settings. So although the job role itself is very highly covered by this survey, there is a wide variety of experience within that category of nursing. Second to that is psychological professions, which includes clinical psychologists, as well as psychological wellbeing practitioners and other associated roles. I've split up here doctors and GPs. That's for the purposes of analysis, because in actual fact, these roles are quite different. So it's interesting to see how these differ in the data. But had they been combined, you would see that they would have been probably the second most numerous category. We've also got quite a lot of responses from allied health professionals. Now, these include paramedics, art therapists, physiotherapists, speech and language therapists, and a whole range of other associated roles. And we've also got some good representation from wider healthcare team here. This is people like healthcare assistants and other assistants in healthcare roles. So in this next section, I'd like to report from our survey what we found out about which healthcare professionals use digital health smartphone apps and what kind of apps they use. So first of all, do healthcare professionals use apps in their clinical practice? Well, in our survey, 56% of all respondents said that they do use digital health smartphone apps in clinical practice. And when we sort of looked in more detail at this and asked them what kind of apps they used, we suggested some different categories of app that they might use. So we suggested they might use guidelines apps, calculations apps, prescribing or dosing apps, or communication apps. And we can see that nearly 25% reported using guidelines apps, more than 20% reported using communication apps, and around 20% reported prescribing or dosing apps, with fewer using calculation apps and other types of app. Now, to get more of a sense of the types of apps they had in mind, because of course we can't control how people understood or interpreted the questions that we put out there. So to get a better sense of that, we asked them to report the types of app they used if they reported other. And we can see here that there's actually an interesting mix, because some of these apps are perhaps more aimed at patients themselves. So things like Headspace and Calm, and Stay Alive, Rise Up, Distract. And some of these are much more clinician focused. So Consultant Connect, ACE Mobile is a consultant or a clinician facing app, and the British National Formulary here. So yeah, we had a mix here. So it's interesting to see how this question was interpreted as to whether the clinicians are using these by way of recommending them to their patients or whether they're using them themselves. So when we look then across different job roles and which job roles are reporting that they use digital health smartphone apps, we can see that pharmacy and students, pharmacists and medical students report using these the most. Now, an important caveat here is that there were only 15 pharmacists who responded to this survey and only 10 medical students. So we may have a selection bias here in that only those who are most interested in technology decided to take part in this survey. Whereas in other roles, through our recruitment methods, through the Healthcare Trust themselves, we perhaps have a wider selection of responses. So here it's interesting to note that non-GP doctors highly reported much use of apps. So more than 70% of them reported using smartphone apps. Just less than 70% of GPs reported using apps. In terms of nurses, we've got just over 60%. Interestingly, the psychological professions used them the least. It's interesting when we think back to those previous responses and the idea that some people responded in terms of what they suggest to their patients. We might think that psychological professionals were recommending apps such as Headspace or Calm, other types of meditation or distraction apps, but this may not be the case, given that only 30% are reporting using apps. So moving on then, section 3. So do healthcare professionals report that their patients use remote measurement technology? So this includes smartphone apps and wearable devices. And if so, for what purposes do they use this remote measurement technology? That is, the patients. So 78% of our respondents said that their patients use apps or devices for health. Now, it's important to remember here that this is through the lens of what the clinicians are aware of. So it might be the case that some clinicians are aware of some but not all of their patients using apps, and they would still say yes to this. It might be the case that while patients do use apps, their clinicians are not aware of this. So there's some, this figure is not an absolute figure, but nonetheless, it's interesting that 78% of our respondents said that their patients do use apps or devices for health-related purposes. So when we asked what their patients are using these devices for, including smartphone apps and wearable devices, we can see that activity monitoring was highly selective, more than 60%, sleep monitoring as well, 55%, and then below 50% for weight management, setting personal health goals, mood monitoring, or monitoring for a specific condition. And we broke that down a bit more to look at, well, are patients using smartphone apps or wearable devices for each of these purposes? And there's some interesting patterns in this graph. So for wearable sensing devices, we can see that these were most highly endorsed for activity monitoring, followed by sleep monitoring. But actually, when it comes to weight management, smartphone apps are used more. Monitoring mood, again, smartphone apps are used more, and setting personal health goals. And when we think about it, this makes sense because actually a wearable device, perhaps a watch, has quite a small screen and perhaps limited ways of interacting, entering data, whereas a smartphone app has a much larger screen and is perhaps easier to enter data on. So for those reasons, monitoring mood, setting personal health goals, or weight management where you might be entering data, you would expect to have more use of smartphone apps there compared to wearables. So what's the impact then of RMT data on healthcare professionals' clinical work? You know, it's all very well that these patients are collecting data using wearables, using smartphones, but does it have an impact in terms of clinical practice? So we asked 5 questions about this. So firstly, we asked whether data from remote measurement technology, this is patients' remote measurement technology, has an impact on clinicians' understanding of patient health state at consultation. So when clinicians are in consultation with their patients, do they feel that RMT data has an impact on this? We also asked in the second question here whether RMT data has an impact on clinicians' understanding between consultations. We also asked whether it has an impact on patients' awareness of their own health. This is again clinicians' perception of that. Also on decision-making processes. So while it might affect understanding, does it actually affect the decisions that clinicians are making? And finally, whether the data impacts communication with patients. Now the responses here at the bottom, we have the key. So in green, which is actually the largest section of each of these pie charts, we have definitely or sometimes. So this is clinicians saying that the data from RMT definitely or sometimes affects their work in each of these question categories. In orange, which is the next section in each of these pie charts going clockwise, we have people who responded unsure, and in blue, which is the final section, we have people who responded hardly or never. So the interesting pattern here is that across all of these questions, more of our respondents said definitely or sometimes than they said unsure or hardly or never. So this indicates that clinicians are seeing an impact from RMT data on their work. And interestingly, they see the greatest impact, according to these data, on patients' awareness of their own health, which while it might not be an impact on the clinician's own decision-making or their own understanding, the fact that patients are understanding their healthcare better may still have an impact on clinical work. And we wanted to break this down a little by job role to understand, okay, which job roles are saying that they see an impact in each of these categories. So apologies if you can't distinguish some of the colours in this graph, but do know that from left to right, these follow the pattern from top to bottom in the key here. And the thing that I want to pick out, there's 5 graphs here, and the things that I want to pick out and the pattern that I want to identify here is that if we look at GPs in yellow, general practitioners, you can see that in terms of whether the data impacts patients' awareness of their own health, nearly 90% of GPs said that there was an impact on this. When we look at the impact of data on GPs' understanding of patient health state between consultations, we can see that it's much less, only around 70%. And in fact, it's lowest when we look at decision-making processes. I can't see it because the Teams box is hiding it here, but does the data impact your decision-making processes at consultation? And here it's at lowest for GPs. So this would indicate that GPs are see the benefit of this for patients themselves, and they see a benefit of the data for their own understanding of where the patient is at, what the patient's experiencing, but perhaps they don't actually see that this data is affecting their decision making itself. So they may still have done what they would have done anyway. Although still 50% of them say that the data has impacted the decision making, which is not a small amount by any means. Just one other pattern to pick out here is that, which one is it? So allied health professionals seem to be least sure of the impact of RMT data, which is interesting. So they're most likely to report unsure on each of these categories. Now, if you're interested in exploring this data further, I'd suggest that once the recording's available, you have another look through. But for the sake of time, I'll move on. So we wanted to understand a little bit more about how the demographic factors that we collected in this survey affected clinicians' views on the impact of RMT data. So was it the case, for example, that age had an impact on whether clinicians thought that RMT data has an impact on their work? Was it the case that clinical setting, those in different clinical settings saw the impact of this data differently, or by specialism, which we've explored as either mental health or neurology. And so what we did, we put this through a multivariate logistic regression. We took account of missing data with multiple imputation, and we dichotomized the responses to these impact questions as either 1, it definitely or sometimes had an impact on their work, or 0, they were unsure, or it hardly or never had an impact. And each of these were categorical variables in the multivariate logistic regression. And what we found, I mean, all the detail will be in the paper when it's finally published. It's under review at the moment. But what we found broadly was that use of apps, so whether clinicians used apps themselves, was a significant predictor of whether they thought that RMT data had an impact on their work. And this might highlight an underlying view, we could perhaps say, of a more positive view of technology. So those who use apps in their clinical practice and are more likely to see the impacts of the data from remote measurement technology. In terms of clinical setting, though, there was an impact on some questions. So some of these 5 questions saw an impact of clinical setting. And age, one of the questions, age had an impact, with those in the 18 to 30 category being less likely than those in the 41 to 50 category to see an impact of RMT data on clinical work, which is perhaps counter to what we would expect. So that's just an overview. Again, all the detail from that analysis will be in the paper. Interestingly, job role did not have a significant predictive effect in this model, but one of the strengths of logistic regression, multivariate logistic regression, is that it accounts for some of the other variables, and so some of the effect that may have been picked up in job role may have been covered by clinical setting instead. We did also, it's important to note, we did do an analysis for multicollinearity in this, which was within an acceptable level. So we don't believe that there was an effect of multicollinearity in this data. So an overview then, a summary. A majority of healthcare professionals report already using apps in clinical practice. More than 3/4 report that their patients use apps or devices for health-related purposes. RMT data appears to impact respondents' clinical practice in a variety of ways, and views on the impact vary to a degree based on setting, based on use of smartphone apps, and to a lesser degree on age. So yeah, we've got some questions for future work, things that the survey perhaps wasn't precise enough about, things that it raises as interesting future questions. So how many healthcare professionals actively recommend or prescribe apps or wearable devices to their patients? So that wasn't covered in this survey, and it would be interesting to know. And we know that the NICE, the National Institute for Health and Care Excellence, is beginning to encourage the use of digital health apps in clinical practice. So it would be interesting as well to know whether this and other incentivization schemes across Europe, so for example, in Germany, there is a law supporting the use of digital healthcare apps, whether these incentivization schemes increase the uptake, use and impact of smartphone apps and wearable devices in clinical practice. And it's also interesting in light of the COVID-19 pandemic and the reorganization of care that's been associated with that, whether that affects views towards the usefulness and impact of RMT data. So here it's interesting to consider, for example, how so many things that were traditionally done face-to-face have been moved to an online or phone or Zoom arrangement, and this is across Europe, in healthcare, so even, for example, in general practice. And it would be interesting to know whether remote measurement technology is seen more favourably now as a result of that. An interesting sort of thought on that is that, you know, whether someone is sat in the room with the clinician or whether they are sat at home, to review data from remote measurement technology, the clinician still has to review that on a screen. So it may be partially irrelevant whether the patient is there in the room or not as to the impact of the data. So it would be interesting to explore that in more detail to know whether that sort of hypothesis is really valid or not. So thank you very much for listening. I'm happy to take comments, questions and feedback either now or by email or by Twitter. So I'm going to stop sharing and hopefully Faith is there to field some questions for me.
Fantastic. Thank you so much, Jake. That was a really fantastic presentation. We have a question in the chat from Michael Miller, who asks, has the research covered the use of data to stratify the patient population on the basis of risk? If so, is there any measurement of effectiveness?
No, it hasn't, is the straightforward answer to that. I think because here we were looking at healthcare professional views rather than patient views, it's perhaps less important to stratify in terms of patient risk, but future work can certainly explore that in more detail. In the next stage of our research, we're going to be doing some more interviews with healthcare professionals, and I take your point that perhaps those at greater risk may need more intervention than those at lower risk, and certainly in the RADAR project more widely, we're looking at how monitoring for patients who are at increased risk could be of benefit. So, for example, in epilepsy, we're exploring how the use of wearables might help in how, for example, when a patient is about to have a seizure or when they are having a seizure, can that raise an alert to reduce the risk of harm from those seizures? Thank you for your question.
Thank you. Are there any other questions from any attendees? I have a couple of my own, but want to make sure that everyone has an opportunity to ask their questions. Maybe I can follow up with a quick one from my own, which is, oh no, there's a question from Karina who asks if you could please show the last slide again with your contact details.
Oh yes, of course. Yeah. Would you like to be queuing up your question in the meantime, Faith?
Yeah, so my question is about the difference between apps that have been developed for specific and validated for specific outcomes in specific patient groups versus apps that are sort of more general health and well-being apps, and whether either this specific piece of research or any of your learnings from your expertise have encountered any differences between those, because in my mind there's quite a large difference between recommending someone to use something that has been specific. So if you're a you know, a psychiatrist and you're seeing someone with depression, there's a big difference between recommending something that has been validated and is specific to depression versus recommending the use of something which tracks step count and sleep count and sort of general fitness and well-being. And I guess I just wanted to raise it as something that comes to my mind as whether that's an important difference based on your experience and whether it's something that you've looked into at all in your work.
Thanks, Faith. Yeah, so I agree that it's an important difference, absolutely. From my own knowledge and experience, I know that, for example, the organisation ORCHA, ORCHA, is very, very involved in reviewing evidence for the apps that are out there. Interestingly, they review apps based on usage. So they look to see whether apps that are already widely used have evidence to support their use clinically, and they review apps on that basis and provide recommendations. I think it is an important distinction in terms of my research, in terms of thinking, you know, what are clinicians using, what are they offering? You know, I showed that list earlier on, which had the some of the other apps that people had listed in the survey, which included ones. I mean, so for example, Headspace does have some research associated with it, but whether it's research that supports its clinical use, whether it's that sort of level of evidence, I'm not sure. So that's another interesting question for future research is, what are clinicians actually prescribing? You know, I think there are, in some healthcare organisations, in some with some software packages in terms of patient records that clinicians are using, they are able to almost prescribe an app or provide a link to a particular app, recommend an app to their patients. And I would hope that they're using evidence-based ones. But that's certainly something to explore in further research that this survey can't tell us.
Thank you. There's a question from Toby Benny, who asks, is the usability of the app or the simplicity of use a factor in their take-up being a success, especially when supporting less digitally confident individuals?
Again, this survey did not cover that. I think that's a question to ask of patients rather than of clinicians. My instinct would be that it would be, but you know, so we'd have to gather some data to support that hypothesis. Yeah.
Thank you. Are there any other questions from our attendees? We have a question saying, I sincerely apologise if this deviates from the topic, but what do you think would be the important factors to consider when introducing technologies like RADAR-CNS or any other digital healthcare tool and ensure that it's appropriately used by patients or professionals who are less tech savvy, the elderly, disabled patients, etc.? It seems like European countries are doing a rather good job of making sure the tech is accepted, supported, and widely used.
Thank you for that question. Yes, important factors to consider. Well, I'd refer you to another part of the RADAR-CNS project at King's College London, the work by Sarah Simblett and colleagues and Till Wykes, where they are exploring exactly these factors that affect patients' take up and use of remote measurement technology. I don't know if they've published their most recent study, but they're certainly doing some very interesting work which explores, they've literally put to patients different categories of different factors that may be important. So things like accuracy, things like cost, things like usability, and they've asked their respondents in that survey, who are patients, to compare these different factors and say which they think is more important. It's a discrete choice experiment, and I can't comment on the results of that because I don't know if they're published, Alex has usefully put up there a link to all our publications. But yes, that study will answer your question there. In terms of clinicians' own views, we have talked about doing something similar, a similar discrete choice experiment with clinicians to really assess what these important factors are and determine which are the most important factors. But I think we need to do some more work before we could say that for sure.
Great. And a question about when the recording might be made available. So I guess this is a question about when you're hoping to publish so that we can all rewatch this presentation.
Thank you. Yes. Yeah. As Alex said at the beginning, unfortunately, we're going to put an embargo on the recording so that it's not officially published before the journal has a chance to publish it for themselves. And it's currently under review at a journal. And I hope that will be successful. And in the next couple of months, that will be published. So as soon as it is, we'll get the recording up as well.
Fantastic, thank you. And we're coming to the end of our 45-minute schedule. If there are no other questions, I thought I might ask another essential scientific question that has been troubling me through your whole presentation, which is, why are there geese throughout your slides?
Why are there geese? Yes, it's just a nice picture. I could have put the picture of the phone all the way through, but I thought it would be interesting to have something else to look at. So
I appreciated the geese. I wondered if they were of relevance.
No, they're not using any remote measurement technology themselves, unfortunately. But yes, maybe in the future.
Wonderful. Thanks so much, Jake. Thank you to everyone for attending. Please stay tuned on our mailing lists, on our websites, for any more information. As soon as this is published, we'll be making these available. If you have any follow-up questions or any burning outstanding issues that you'd like to talk about with Jake, please do contact him via the contact information he posted. And otherwise, you can always contact us via the RADAR website, which is radar-CNS, radar-CNS.org. Thank you so much for attending, and we hope you have a really lovely afternoon. Yeah, thank you.
Thank you and goodbye.
Goodbye.